growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, you are tuned in to The Lionhearted Dentist with Dr. Steve Rasner. We are into March of 2021. And I have a very important podcast for you tonight. It is not even the podcast that I intended to deliver. But I received not one, not two, but 3 emails in 1 week on this same subject. And if I'm covering your email tonight, it's not in any way intended to undermine you. I'm so thrilled when you guys send me emails. I know you can tell that in my voice, and I mean it, because it tells me that I'm connecting. But the content of these emails just made me believe that many of you, if I'm going to get 3 in a week, and I've had similar emails in the past, tells me that many of you just aren't listening to me. You're kind of listening, and that means I'm not doing anything for you. It means I'm not connecting, especially on the subject I'm going to bring up. So first, let me give you my email. It's my name, Dr. Rasner, Rasner, no period after doctor, at AOL.com. Number 2, thanks to all the dentists around the world and staffs, team members of those dentists that continue to listen to me. Somebody in Ireland is showing a lot of love lately. I mean, by that I mean you're downloading a lot of episodes, and I love it. And remember about a couple months ago I said South America doesn't give a hoot about the Lionhearted Dentist or Dr. Steve Rasner? I have a couple countries down there listening now. So, thank you. But let's get to it, man, because I'm somewhere torn between ticked off and frustrated. And here's why. So remember, those of you that wrote this, I get a lot of this stuff, and it makes me believe that I'm missing it for you, that I'm not delivering for you. The email was brief. It simply said they were having difficulty with patients accepting a scaling root planing or even a G-scale. And the question was directed in a way to me, and mind you, there was 3 of these. And the question was like not even about the fact so much that they were rejecting it, but more about an appropriate letter for this patient that's denying treatment. And would that stand up in the future if there was a problem? So this is what that shouts to me. Because when I come on this podcast and I say to you what I'm about to say, it's because it's real. I don't exaggerate on this podcast, because being disingenuous about anything you should be doing based on my results it's almost criminal to me. It'd be terrible. The information I give you has to be extremely accurate. So I am telling you, I can't say 100% of the time, but pretty darn close, have patients accept whatever soft tissue care I'm recommending. And if you say to me that they're not accepting a scaling root plane, and maybe I don't know all the parameters around that story you're giving me, it tells me, number 1, there's many of you going through this, way more than the emails that I get. And it's probably happening and spilling in to other recommendations that you make. So what does that tell me? it tells me that I don't think you have approached the case presentation portion of your day, in other words, what you're recommending to a patient, the way I've implored you to do it. Listen, you should be listening to me, in my opinion, for a lot of good reasons. But one of the top ones, if not the very top one, is the case presentation protocols that I share with you. Why? Because it determines everything. It determines how you spend every day, whether you're productive or another wasted day. I used to say, when I would be speaking to big audiences, and I got to the portion of my presentation that addressed case presentation, I used to begin that section by, I always had this dramatic introduction to whatever I was talking about, whether it was your clinical skills, whether it was your team and how to motivate them. But when I would get to the part right before case presentation, I would say, how you spend your days, whether they're peaceful or frenetic, whether productive or another wasted day, has everything to do with patients saying yes. How many patients you see each day. How able you are to contribute yearly to a team pension contribution that you've set up. If you get lunch, if you're having fun, has everything to do with patients saying yes. And when I say that so succinctly about patients saying yes, we both know what goes into that is the mass majority of the population, in my opinion, go to dental offices where they receive one-tooth symptomatic myopic care. I'm sorry. I'm just going to say the way I see it. I've been in this 40 years. I've seen thousands of patients that were the patients of other dentists. And the vast majority have been treated. It's obvious. It's obvious by what was done in their history of their mouths, by looking at their mouth. You can tell that they had symptomatic one-tooth dentistry. Do you think I come on this podcast to encourage you to do comprehensive dentistry because you'll make more money? If that's what you really think, then you need to check out now and save your time, because that is not in any shape or form what I'm talking to you about. Everybody listening to this podcast, even if it's the last one you listen to, should know that comprehensive dentistry is best for you and the patient, especially the patient. It's best for you because why are you an oral health care worker? Don't you care about the outcomes of your patient's oral health, not just now, but 10 years from now? Is it really up to the patient to know whether or not the early periodontitis, it may even be gingivitis at this stage, which is asymptomatic to them, is it up to them to diagnose themselves, or is it up to you? They don't know about puffy, red versus pink, tight, stippled gingival tissue. They don't. So I've given you so many parameters and so many approaches, and maybe you skip those podcasts. But the reason I don't get rejected with a patient saying, I don't want to do scaling root planing, is because, number one, it is, as you've heard me use the phrase, a line in the sand that I will not cross or let them cross. You don't have to replace teeth if you're my patient, if I don't think it's deleterious to your chief complaint. So let me be clear about that. If you came into my office or your office And the reason that brought you to me is a crown keeps coming off. And that's related to an occlusal problem that is secondarily related to a lack of teeth. That's a different story. But many of us have abundant patients missing a first molar. In some cases, even the space has been preserved. And there's minor movement of the adjacent teeth to the tooth that was lost. And it's been like that for 10 plus years. And there's tremendous buccal bone resorption. And I would be very cautious about talking to that patient unless they brought it to my attention that it bothered them about getting a ramus graft or guided bone regeneration and then an implant. I think that would be a very bad approach. I often see 30-plus-year-old silver fillings that many of my colleagues would automatically treatment plan for replacement. I don't do that unless there's obvious decay, unless there's a pullback from the margins that I think needs treating. It kind of obviously depends on the size of the restoration. What I'm saying to you is there are things that don't cross that line in the sand. But perio, the refusal to treat any level of perio. So here's how that plays out. It is crossing the line. And I won't do it. I can't even begin to do it. In my mind, it feels wrong. So I don't want to go through the whole case presentation thing, but I need to tell you, those of you that are getting turned down for your whatever you're recommending, have you been honest enough? Have you really gone back and looked at what your process is? And God knows I beat this up a lot. I mean, we talked. The process begins with your branding. I mean, somebody called your office for a reason, right? Well, some of you don't even advertise, but for those of you that do, what's the message you're putting out there? Well, my message is trust, confidence, and sedation also. I know they're two different messages. I do that on purpose because it is the staple of my organization. Number one, we've offered sedation, oral sedation, at no cost for probably 20 plus years. And I've advertised that. And that brings in a wonderful patient to those of you that are thinking about providing oral sedation. It does. Because you get a patient that wants to go to the dentist, but they're scared. And they come in all forms from, in my particular practice, I would say from 15 to 80. 80. And I actually get referrals from other dentists. Look, I get that not all dentists want to deal with the fearful, phobic, uptight patient. I understand it. But it's not even a thing for me to treat. It's just like a regular patient for me in most cases if I use my sedation protocol that you've heard me talk about. So that's one staple for my practice. The other is one other thing. Like, I'm not out there advertising my hours, which I used to do very early in my career. And we were open at nights and those type of things, or open at on Saturdays. You know, that's not what I'm advertising. I never imply that we're the lows of dental offices, meaning we're affordable. Look, I think there's a product in your community, a market, in your community for excellence in everything you as a dental office have to offer. That covers everything. Your clinical work, which is what we're really talking about right now. Your staff, your ability as a team to make people feel value. We don't have to overcomplicate this. It is as simple as that, but it requires constant energy by myself and you to keep making all this happen. I mean it. Tonight, before I came on with you, I hit an email. I did. You'll love this. I have been in this 40 years. I sent an email to my front desk team. You know what I said? I said, I need you to step it up when I ask you something that I need done during the day, to either get it done or be very, very cognizant that you've told me where I'm at with that. Because what happens if you don't is it becomes either totally forgotten or it lingers in the back of my mind. One of the most valuable employees that you could ever hire is the one where you ask for something one time and it gets done. So if there's staff listening tonight, you don't all do that. And I love these two front desk team members I have. They are amazing with the patients. The patients love them. They probably spend too much time checking patients in, checking patients out. I'm serious. But I don't say anything because that's the atmosphere I try to foster. But I sent them a pretty stern note because that's what I mean. I'm telling you this because, yeah, it's a simple formula. Treat people with value, provide excellence, make your word count, be fair, do something clinically and socially, something each week that has nothing to do with anything except establishing a relationship-based practice. So there's a lot that goes into all these things. By the way, what I mean by that is I'll throw in something free every single week, multiple times. I mean, I did it today. Tell me, you never went in to do a restorative procedure and you missed a little lesion, or you got in there and think, well, I should have done the next tooth, a filling on the next tooth. You better not charge for that if you didn't diagnose that in the beginning of this relationship. Like, I'm talking about somebody you recently met, you treatment planned, a restoration on first upper right molar, and when you got in there, you missed something on the premolar, or maybe a little distal caries that you could fix very easily because you're in the next tooth anyway. Yeah, I do something like that almost every day. I do. And I do something socially bonding as well, whether it's a card. I hope you're feeling better. Sending somebody a fruit basket. I mean, it is constant. You can't fake a relationship-based practice. You got to earn it. And I'm here to tell you that I practice in an area that I call it challenged economically. I should get some kind of award. It's like a Nobel Peace Prize award for what I've created in the area that I'm in. I'm not saying it's all bad, but it is downtrodden. It has been beat down for years. It's not the people that live there's fault. Industry's just left this area over and over, year after year, for the last 30 years. The last 40 years. It's true. You could research it yourself. So it's not the people that happen to settle in the area of the United States where I live, but it's a fact. So for me to share this practice with you, dead in the heart of that area that I just alluded to, is not an accident. It requires a constant, ongoing amount of energy from me to make sure I get things done and cross T's and dot I's, as well as my team. And that's all a part of that process is your case presentation. When I say case presentation, let's just be honest with each other. A patient calls you up and they have a specific issue of which they came to your office for, right? They broke a tooth. I don't know. They're in pain. They don't like the way they look, which, that's a wonderful thing because even that patient would understand that involves more than one tooth. And they get to you based on word of mouth, a referral, your branding. You hear me? I'm trying to tie this all up. Why this is so important. And then they go through your process. And that's what I'm asking you. What is your process? Do you have a process? Because if you're just listening to me on these podcasts, but you haven't used the 120-day rule, remember that's the rule where I said, try something I'm offering you for 3 months or 4 months. Make it a 90-day rule. And if it doesn't change, then drop it. It didn't cost you anything except the time that you've listened to me. Go back to the case presentation. Do you remember what I said I do? I pulled up a lecture. I need you to hear this. So what is that process? Real quick recap. The process is they come into the office and they're treated with value, and that includes being seen on time. Well, we are seeing patients pretty much always on time. And I wasn't always good at that. You know how I got better at it? It became something important to me. It became important to my culture. I'm not kidding. I remember the days where I would have patients waiting 30 minutes or more all the time. And I didn't do it to be arrogant. I just didn't focus on that part of my office enough. And I'd love to talk about any of these things with you. If you get a little energy and email me if you want me to expound on this, because I know it's a lot to take in. And remember, I realized how I started this podcast. I told you I got a couple emails about the fact that somebody didn't accept scaling root planing or soft tissue care, and do I have a protocol for that? And the protocol is all encompassing. It's everything counts, right up to the point where I finally walk into the room, but it's not a random series of events. It's always the same that lead up to me walking into that room. And I am, and you, I'm sorry, we're on stage. We are. I walk in, and I'm not standing behind it. I've heard all kinds of horror stories from patients about why they left the office that they left. I sit down. I'm incredibly inviting. I have a lot of time. And I walk in, introduce myself. And remember, I told you there's a significant other almost always somewhere in that room at that point after the x-rays have been taken. And remember, they've had a one-to-one interview with my office manager, even though she offered and talked to them over the phone about many similar questions. And there's reasons for all of this. And I walk in, and I'm coached. I'm told by my new patient coordinator any revelations, what to expect. But I got to tell you, if you follow it the way I'm sharing with you, whoever's in that room is going to like what I say. And I actually say it that way. I always start out by just saying, hey, how'd you guys find us? It's kind of really how I talk. And they'll tell me, and I do that all the time. I love to hear how they discovered the office. And it could be a magazine I use. It could be a radio commercial that I use in my area. And all this stuff's been documented on these podcasts. Or maybe a relative goes to me, which is even better, or a friend. And I'll say, well, look, before I even look in your mouth, and sometimes I'll acknowledge why they came, because I know. I know you came in because you broke the porcelain on a crown in the back of your mouth. That happened today, by the way. I said, here's who I am. Here's where you're sitting today. And I tell them really how much I love what we do. I take them all the way back. I say, listen, what do you do? That's what I say. That's what I said today. So what do you do? And the patient said, I'm a nurse. I said, then you're going to totally get me. I said, you know and I know that not all nurses, not all teachers, cops, lawyers, not all dentists are equally into what they chose to do. We chose it at some time early in our life, and it's not criminal not to fall out of love of what you do. And a lot of us just go through the motions. I'm sure you know nurses like that. That is not where you're sitting today. I am the complete opposite of that. I've always been 100% on board, gung-ho, on everything I can find out about what I do each day, to do it at the highest level. And then I'll say, and one of the subjects I like the best is called What to Do When. Now, you and I have a course called What to Do When. But I'm telling the patient it's a subject. I said, because every time a patient sits where you're sitting right now, we're in that moment of what to do when. What's the right thing for me to recommend to you? And that may seem obvious to you, but it's not. But here's how I find that out. Here's how I know. I look at 5 things. And the very first thing I look at is the health of your gums. I look at a patient and say with full conviction, I look at that first on purpose because that sets the tone for anything else I'm going to tell you. I'm not going to let you or recommend that you spend a lot of money on your mouth if I don't trust the health of your gums. And of course, we both probably know that the health of your periodontium, your gums, are the gateway to the rest of your body. And I talk like that. And I got to tell you that the great abundance of patients, new patients that I meet, don't have great periodontal health. And when they do, I make it a big point. I said, I got to tell you something great already. You are how old? Well, you have the bone in your mouth of a 24-year-old. Now, your gums, we could do a better job of. But you are not vulnerable to bone loss. And you have no idea. I know that may mean nothing to you, but it's huge. Guys, we're into 29 minutes already. And I could go on for an hour about this. And if you want me to do more strictly on very case specific, and we're talking about patients that don't accept it, what you just heard me say is delivered to every patient. I am telling them that it's the first of 5 things I'm going to look at on them. And I tell them that, and I tell them why. And I don't overwhelm them with 11-letter scientific words. I just talk the way I'm talking to you right now. And I'd love to expound on that if you'd like me to. Sometimes they don't accept the other treatment that I recommend, but they'll accept periodontal maintenance. Or not maintenance, but periodontal health. Quad scales, a G scale. And by the way, I'm emphatic, and I don't know if I was 25 years ago, that if they're going to do this and take my recommendation, then they're going to end up coming in either at 3 or 4 month recall. And I will be able to determine that as we go through treatment. But it won't be 6 months, and insurance won't pay for that. And I say to them, and that's going to come around so quick, you're going to say it can't be possibly due to go to the dentist. This is a life commitment, and I just get into it with them. This is a life commitment. I have a boatload of patients that had 20, 30% bone loss that I met 40 years ago that still have their teeth because they're on board. They understand it's important to them. And it's so much less expensive than losing teeth and having to commit to today implants, for goodness sakes, partial dentures, which we don't want to have, et cetera, et cetera. And it's 100% truthful. That's why it's so easy to espouse. But I've been doing this 40 years, and you can even hear, I think, the passion as I get myself in that scenario in my head when I'm with a patient. You can imagine when I'm with the patient. Are you doing this? And are you doing it well enough? So I don't like keeping these more than 30 minutes. I appreciate you tuning in. I always go off on tangents as if you don't know. But this is what commanded my attention this week because of what I said earlier about the emails. And I love you guys sending me stuff like that because it tells me what to do on these podcasts. So thank you so much. Everybody, stay tuned, stay strong. Change something this week that you haven't done before. See if it works. If you're listening to me and you're following these blueprints, they work. Have a great week. See you next week on The Lionhearted.